Your bones do more than support you as you sit and stand. They also contain stem cells whose job it is to become other specialized cells when your body needs them. Bone marrow stem cells are collected through a procedure called a bone marrow aspiration. Before the procedure, patients are usually given medicine to help them relax. During the procedure, a physician numbs a small area on the back of the hip and then inserts a needle into the hip bone to withdraw about 6 tablespoons of bone marrow. The bone marrow is then processed in a laboratory to separate out the stem cells. The laboratory prepares the cells to be put back into the heart just a few hours later in the cardiac catheterization laboratory or cath lab. The procedure to put the cells into the heart is very similar to a balloon angioplasty. A cardiologist makes a small cut in the upper thigh or possibly the arm, and then a catheter is inserted into the artery and threaded to the heart. The cells are then introduced into the heart through the catheter. The research scientists are hopeful that the stem cells will improve the blood supply to the heart and the heart's ability to pump blood. Recent research has shown that when stem cells are placed in an ailing heart, it is possible for these cells to change. They may become heart cells and also encourage other cells in the same area to become new heart cells as well. It is also possible that some of these stem cells may help create new blood vessels that would be used to deliver blood to the heart muscle that needs a new supply to stay strong. The information gained in the CCTRN research studies may improve the understanding of the safety of using stem cells in the heart and aid in the advancement of medical knowledge. As with many clinical trials, there is a chance of receiving a placebo, which is a solution that contains no stem cells, but rather only salts and proteins. We have been given approval to give twice as many people the stem cells from their own bone marrow as the number who will get the placebo solution. It is necessary to give some patients a placebo solution in order to reliably test the results of the trial. Neither patients nor the doctor and staff knows who has received the placebo and who has received stem cells. Patients who receive a placebo solution will get the same care for their heart condition as the patients who get stem cells. All patients will have direct access to the research team for at least 2 years.